doesn't say 7 o'clock on that clock.
Yeah,
Well, I can't see that far then.
It's just go by your cell phone.
Okay, so it's 7 o'clock, so I'm gonna open the public hearing on the draft of tobacco regulations. Accordingly, I'm gonna read the public notice that was published. Public hearing notice is hereby given in conformity with the requirements of the general laws of the town of West Boylston, Article 23, public hearing notice, and that the West Boylston Board of Health will be holding a public hearing on Wednesday, November 9th at 2016 at 7 o'clock to consider amendments to the current tobacco regulations. Regulations of West Boylston Board of Health restricting the sale of tobacco and nicotine delivery products. The copies of the proposed amendments are available during business hours in the Health Department for your review. Any person wishing to be heard should appear at the time and place designated above, or should send a letter to the Board of Health in time to be read during the hearing. Please note, individuals requiring special accommodations should contact the Health Department at least 5 days prior to the hearing and to facilitate your request. Thank you. And this was dated October 23rd and the 30th, 2016. So first I need to tell you that we're going to consider the changes that we have a draft. I don't know that we've received any written comments, have we? We've received no written comments. I'm going to ask people to speak on the draft regulations if they'd like, but I'm going to limit that to probably 5 minutes. So is there anybody here that wants to speak with regard to the draft regulations?
Oh, lots of people.
Okay.
It makes sense to start with me.
It does, yeah.
So, hi, good evening. My name is DJ Wilson. I'm the Tobacco Control Director at Mass Municipal Association, and I assist cities and towns in developing local policies on tobacco issues. I've given you a handout that lists, it's a statewide 4 lists that have what cities and towns have done statewide, and I was just going to go through these 4 proposed policies and let you know where we stand in Massachusetts. So the first handout are those cities and towns that have moved their minimum legal sales age from 18 to 21, and you'll see that there's 138, there's actually 139, I failed to put Medford on. So, and we have 60% of the state's population living in cities and towns that are at 21. This has been, the first town to do so was in Needham over a dozen years ago, and this has been actually a surprising, easy policy to put in place. Retailers it's easy to communicate to them, they've been good about compliance, and the state does provide a free sign that says 21 on it for cities and towns to hand out to retailers. The second list are those cities and towns that have put minimum pricing in for cigars. West Boylston is actually listed on this list, but you have the original policy, and so what you are looking at tonight is the updated policy. The problem with the original policy is it said that a single cigar had to sell for at least $2.50, which is the same as the proposal, but it said that anything 4 cigars or over could be sold at market rate. And we ended up seeing across the Commonwealth packs of 4 or larger than 4 being sold for as low as 99 cents. One of the categories of products that we've seen are these small cigars that come in a pack that looks just like a pack of cigarettes, but says small cigars. They oftentimes are flavored. Seneca is a popular brand. Seneca comes in grape cigars, and the pack I bought, this was $2.20. So it's far below the average price of a pack of a brand name cigarette, which is close to $10. So the updated policy will capture those products as well as those multiple packs that are being sold way below the price of $2.50. The third listing is those cities and towns that have limited the number of tobacco sales permits. You'll see that we have 83 cities and towns that have put a cap on the number of permits to be issued. A simple cap is simply going and typically towns say, we're at blah, blah number, we're going to add 1, and that's our cap, and just stay at that. The idea here is to slowly allow for a reduction in density of the number of tobacco retailers per city or town. It has exemptions to it that allow the current retailer to renew their permit, and it also has exemptions, for example, that I could sell my store to somebody, and they can capture my permit within so many days. That makes sure that the sale isn't adversely affected by the buyer not being able to capture that permit. So it's not meant to be a reduction like this, but a really gradual, slow reduction. And sometimes the reduction will take so many years that the reduction will happen just because your population will grow and your cap number may stay the same for a while. And the last list is the one that's the most contentious, but it's the one that we have the most legal underpinnings to, and that is limiting flavored tobacco products or vape products to certain qualifying adult-only stores. We would never have done this had it not been for the city of Providence in Rhode Island passed a city ordinance that put in language that did exactly what I just said. So it's no flavored tobacco products, no flavored vaping liquids, except for menthol or plain, can be sold at a general store that people can walk into, except for qualifying tobacconists or vape shops. They were sued immediately, but they were sued by the tobacco industry, and they were sued in federal court. So they won at the Federal Court of Appeals. The industry chose not to go to the U.S. Supreme Court, but we are in the same federal court district as Rhode Island. So we do tack very closely to the Rhode Island language. So if you look in the draft, you'll see a number of confusing definitions. They all work with each other, and they were all part of that successful lawsuit. So that's why we have them in there. So this does not. This isn't a complete ban, but for those qualifying stores that are tobacconists or want to be so, or want to be an adult-only vape shop, would still be able to have flavored products, but it would narrow down certainly the number of stores that would be able to sell these products. That, just to go back in time, in 2009, the federal government banned flavored cigarettes, but not anything else, not cigars, not chew, not spit, or anything else. But flavored cigarettes, and part of their reasoning was they saw it as a starter kit for youth, these flavored cigarettes. And that same public health rationale was used in Providence, in their case, and we use it today. Thank you.
Okay, thank you. Thanks. And who else would like to speak? Sure.
Hello. My name is Tina Grasowski, and I coordinate the Central Mass Tobacco Free Community Partnership. And as I said before to some of you, I work fairly closely with the Worcester Division of Public Health Regional Health Alliance, which controls the Tobacco Control Collaborative that you participate in for your inspections in West Boylston. I'm here tonight. The Tobacco Free Partnership works to reduce smoking and secondhand smoke, obviously, in all of Central Mass. And although I'm here to speak in favor of all your regulations, I submitted a letter in support as well. I want to specifically speak for a couple minutes on your flavored tobacco restriction regulation. As DJ said, this regulation is probably one of the most important that a town can implement. And the reason being that in 2008, 2009, the tobacco industry specifically found out that it's illegal to manufacture flavored cigarettes. So eliminating the flavor of menthol, you cannot produce and manufacture in the United States flavored cigarettes. So at the same time, they realized that their consumer base was dropping. Smoking rates have gone down to great public health realization, and work really hard for all the public health that's been done in this country and education. So the industry realized, well, how are they going to get new consumers? Because they need to sell their products to be beholden to their stockholders. So when we saw their industry records, we see that they specifically decided to start manufacturing flavored tobacco products that would be enticing to youth, so that they could start young people with a nicotine addiction and then get hooked on them and then be lifelong consumers of tobacco products. So that's why this restriction is so important, because we know that youth are using flavored products to begin a nicotine addiction. Youth in the United States know all about flavors. They know about bubble gum, cotton candy, tutti frutti, strawberry, grape, because they grew up on it. They grew up on flavored cereals. They've grown up on flavored Jell-O, flavored yogurts, and they know without a doubt what flavor is in. So any product that looks and acts and feels and tastes and reads and has colors on it that are like flavor, this is what the youth market is using. We know from current data, and there was a recently just a new article in the Journal of American Medical Association, which I can get and pass on to you if you're interested, that the rate for electronic use of cigarettes by youth in the United States is up now to about 37%, and that's due to all the flavored electronic cigarette products. And the new article shows that not only are they using electronic cigarettes, but they're going on to use regular combustible tobacco at higher rates. And that's exactly what the industry would like to see. And that's what we've been concerned about for many years, and now the data is starting to come in because we have some research on it. So as you see, several other towns have passed this regulation, and what we're hoping is that the towns in Central Mass will all work together to pass this regulation so that youth see that they can't go from Worcester to West Boylston and buy products, or if they go up to Fitchburg, they won't be able to buy products. If they go down to Grafton, they won't be able to buy products, so that that will stop at least the youth access that we have control over through regulations. So any questions?
I do. Chewing tobacco typically is flavored, and now it says that the regulations proposed say that tobacco products prohibited would be no person shall sell or distribute or cause to be sold or distribute any flavored tobacco product except smoking bars and adult-only retail tobacco. So flavored chewing tobacco would not be able to be sold.
Correct.
Except at that place that's in the,
Sure, we have
At
one
one place.
tobacconist, right.
Right. And that includes now the product called snus, which is chewing tobacco that is put into small, tiny, almost tea bags that maybe Megan has spoken to you about, so that we know youth aren't using chewing tobacco as much, although some do, but they're using these small tea bags, and because it doesn't produce so much saliva. So those would be included as well. Yeah.
Does the board have any other questions? Okay. Thank you. Is there anybody else that wants to speak to the issue? Mr. Crowley?
Pat Crowley, 64 Bowen Street. I don't want this to come across that I'm in favor of getting people smoking cigarettes or any type of tobacco products. Obviously, the health implications of using tobacco products is well documented. But I think it's ridiculous that we're going to raise the age to use a legal product from the age of 18 to the age of 21. When someone turns 18, they're an adult. They get to vote. They can go to war. They have all of the trappings of being an adult. Yet we're going to tell this person that's 18 years of age that they're not allowed to buy a legal product. The age in this country for smoking cigarettes set at the federal level and at the state level is 18. I think we're taking away the liberties that people have earned by attaining the age of 18, as far as the products that we're limiting in the regulation. Again, if it's a legal product and it can be legally sold, why are we telling a retailer that wants to sell a legal product that they can't sell a legal product? Alcohol is bad for you. There's flavored alcohol. Wine coolers is the alcohol of choice if the kids are going to get their hands on alcohol. If we're going to go down this road of saying we're going to do this to stop underage drinking, why not say you got to be 21 to get a car? You're going to have a lot less traffic deaths for somebody if we wait till somebody is the age of 21.
You have to be 25 to rent a car.
But not to drive a car. So, I mean, I don't want to, I could cite a million examples, but
I can go the other way, Pat, as well.
I just, as a as a matter of course, I don't think we should be taking away people's liberties because we don't like a legal product. And I understand the legal product is bad for you. Alcohol is bad for you, but we allow it, and you have to be 21 to buy alcohol. I understand that, and I understand the reasons it was done. And 20, 25 years ago, if we were doing the same thing, I'd be making the same argument against raising the age. So I just think if you're an adult at 18, you're an adult, and you're not a half an adult.
Okay, thank you. There's two folks that just came in. Did you sign in? Would you please sign in? Is there anybody else to speak on this regulation?
I would just
I'd
like,
like to
go ahead.
say something, if I may, in answer to.
Well, we're not going to start debating this, okay?
I would just like to supply some information.
Uh,
I'd just like to
yeah,
supply some
okay,
information.
okay, yep.
No, I know, I'm not going to debate. I'd just like to supply some information around the policy around raising the age to 21 and why we are proponents of it, that youth who are 13, 14, 15, 16 can find a 19-year-old in high school. Several kids are 19 when they're in high school, and can ask to have them purchase the products for them since they're not of legal age to do so. But most 14 and 15, 16-year-olds don't know a 21-year-old. So part of this reasoning behind raising the age to 21, as you may know, is to keep the youth from being able to find somebody who's 19 to purchase the products for them. And therefore, again, it's another strategy to reduce youth access to tobacco products.
Thank you. Alan, did you have something to say?
No, but just when the difference in, I can appreciate Mr. Crowley's concerns about more regulations, but comparing alcohol to tobacco, alcohol when used appropriately is not dangerous. It does get used inappropriately, so it's dangerous in that sense, whereas tobacco, even when used appropriately, is harmful to health.
Okay. Is there any further comments? Hearing none, then I'm going to close the hearing. Thank you for your comments, and we're going to proceed with our agenda. We're not going to make a determination until our next meeting.
So next meeting, we'll follow up.
Next meeting, we're going to vote.